in your practice, do you feel like you're out on an island, or do you solicit help?
Actually, I am.
You're on an island. Excellent. Well, presumably there's some bridges and boats and ways to interact off that island, and cell
that's
phones
actually a
and so
great
forth.
play, because I think all the team members are those bridges and those boats that could get the patients to the destination that they need to get to. So what's very nice is that you have this interdisciplinary team, which is very, very helpful. But not every place in the United States has that luxury, especially in rural America, where we're really relying on the small-town pharmacists to really help along with ensuring adherence, and also to help with, answering any questions, as you mentioned before, about initiating a titration algorithm in patients that may be on an insulin, or maybe helping along with some of the financial burdens that the patients may experience, because some of these agents could be a little bit more expensive. So
Tripp, might I say you're a small-town pharmacist?
That's one accurate statement.
How might you work with some small-town physicians as far as updating on guidelines, updating on therapy, or even some non-traditional ways of working together that aren't traditional practice, but maybe speak to community events or education? You're in a small, tight-knit community. Have you tested any other sort of models of collaborating that we might not have heard of?
So it's funny, talking about collaborative practice agreements or collaborating in a small rural area, it's all just people. So it's me working with Dr. Robbins and working with the other nurse practitioners in the area, and we see each other at the grocery store and at church, and it just is what it is. And so the collaboration is daily. There's nothing formal. Everybody wants to put it in a box, like, check these boxes. These are the things that you can do and you can't do. If we've got a patient that just started on insulin, they know that we're a really good place to send them, because we've got somebody that can sit down and help them with titration, check on them, call back and say, hey, we wasn't working. We're going to bump it up a little bit, adjust your notes and your chart and so on. Also to check in on these patients and then refer to the folks in our community that we know specialize in certain areas. So mental and behavioral health, we work very closely. Son plays basketball with the director of the clinic, understand that we've got a personal relationship. It's easy referral, right? And so collaboration is, what gets trickier is when we've got something specifically we want to do, because then we're breaking down that little personal, we're helping each other out. It's like, hey, I've got something I really want to talk to you about, and this is something that we're, like pharmacogenomics, or something that we're really excited about. It's not always a good idea on the other side. It's fine. The relationship still continues, and we still greet each other in the grocery store, and we still share information back and forth. So I think that's one of the challenges in the community, is thinking, well, I may burn my bridge here by throwing something out that we think is really important. What if they don't like it? Well, it's okay. It's something we need to go down that path. And eventually, over time, what we found is these things that maybe we brought up 2 or 3 years ago come around, and all of a sudden we're collaborating on a project with a local prescriber on something that we thought maybe was a good idea then, but it became a really good idea now.